Implementation. Implementation is the fourth step of the nursing process. Ideally, interventions should be evidence-based, they should be the most current, and they should be the most effective. Two different types of nursing interventions include direct care, which are interventions that are performed through client interaction, and indirect care, which are interventions that are performed away from the client but on behalf of the client. Again, we have critical thinking here. Use the critical thinking process to determine possible consequences, positive or negative, that may result as a result of the implementation of the interventions or the non-implementation of the interventions. It is acceptable and preferable for nurses to review skills prior to implementation if they are uncertain about the proper steps. Standardized nursing interventions are available, but they need to be individualized to each client. The Clinical Practice Guideline systematically develops a set of statements to help the healthcare team make decisions about appropriate healthcare for specific situations. We also have standing orders, which are pre-printed documents that have orders for routine therapies or procedures. They do give nurses legal protection. Standing orders would be for things like Tylenol, 325 milligrams, 1 or 2 tabs, Q4 hours, PRN, fever or headache, or fever or pain. And this is a standing order that the physician allows the nurse to write if the patient needs something, needs the Tylenol. NIC interventions, again, are the standardized common interventions for various NANDA diagnoses. And standards of practice include competencies for care, interventions, and technologies, and they emphasize implementation of a timely plan following safety goals. Make sure that you always reassess your client. It helps determine if proposed actions are really appropriate. Reassessing your client is always necessary when there is a client status change. Review and revise the nursing care plan. An out-of-date care plan compromises the quality of care. And generally, your facilities are going to require you to review these routinely. Depending on the facility, it might be every shift. It should be done with every client status change, and often it needs to be done after the physicians have made rounds if they change the orders. You need to organize your resources and your care delivery. So when you go take care of something, make sure that you have the appropriate equipment and staff to ensure timely and safe delivery of care. Make sure that you always educate the client on the intervention. You need to anticipate and prevent complications. Look for and learn to recognize risks to the client and take measures to prevent complications. Implementation skills require cognitive, interpersonal, and psychomotor skills. Direct care involves activities of daily living. These are activities that are normally performed in the course of a day, such as ambulation or hygiene, eating, dressing, etc. Clients are encouraged to perform the ADLs as they are capable. My favorite thing to do is say, okay, here's your toothbrush and your toothpaste. You brush your teeth and then I'll come and I'll take care of all of the supplies. Or here's your bath water. You get all the places that you can reach and then I'll help you with what you can't reach. Instrumental activities of daily living would be skills required for independence in society. Maybe grocery shopping or being able to take the mail out to the mailbox, etc. Physical care techniques is the safe and competent administration of nursing procedures, such as turning a client or administering medications. Life-saving measures would be physical care techniques used when a client's physiological or psychological state is threatened, and the goal is to restore homeostasis. Counseling will help a client use a problem-solving process to recognize and manage stress. It involves emotional, intellectual, spiritual, and psychological support. It might be just a temporary situation. Teaching. Optimal healthcare requires client knowledge of disease processes, treatments, and medications. Nurses provide ongoing client education during the provision of nursing care. Controlling for adverse reactions. An adverse reaction is harmful or unintended, and it's a reaction to an intervention or a medication. These reactions must be anticipated and precautions are taken to prevent and or minimize the risk. And preventive measures. These promote health and prevent illness. Increase the emphasis on health promotion and illness prevention. Indirect care involves communicating nursing interventions. It would be your nursing care plans, written and verbal communication, documentation of care, and it should always be timely. Delegation, supervision, and evaluation. The nurse that delegates a task, once again, is responsible for ensuring that the task has been appropriately performed, and delegation should always be to competent personnel. Compliance in achieving patient goals can be accomplished by adequate discharge teaching, adequate discharge planning, and the client and the family buying into the treatment plan. So don't forget to involve the client when you're planning your implementation of your interventions.